present here. I, Diksha Gambhir from Medisage E-Learning Private Limited, a platform where medical minds unite to elevate knowledge and transform patient care, warmly welcomes you to the Pearl program on a very interesting and trending topic on game-changing innovations in assisted reproductive technologies, that is ART, with our expert, Dr. Ritu Santwani, a renowned obstetrician and gynecologist, infertility specialist, and sexologist. She holds prestigious qualifications MBBS, MD, FICOG, FIAOG, ART, Singapore, and is the founder and CEO of 360 Degree Healthcare Studio, NUHS, Singapore. Recognized among the top 50 influential doctors on social media, he is also the co founder of MAAM and a board member of SWWC. So, Dr. Santwani, we would love to hear your insights on today's topic. So, welcome to the session and over to you.
Thank you, Diksha. Thanks a lot for a kind introduction. So, warm welcome to all of my dear friends who have joined all across the geography. Friends, actually, this talk was requested to me by Diksha. Now I can say my dear friend Diksha. So, because Diksha was after me, ma'am, I am getting a lot of requests for that. What are the new innovations in male and female infertility? She asked me so many times. I thought कि चलो अब ये lecture prepare करते हैं कि this is, and I found some very good, interesting points that I'm going to share with all of you. So yesterday when I posted the flyer for this, friends, you can't imagine. I got the messages in the Facebook from Israel, from Australia, from Cairo, from lot of neighboring countries, from KSA, that all want to listen this topic. So now, without further delay, I'm starting sharing my screen.
Yes, it is visible, ma'am.
So is the program is going live? Have you checked? Because some, or I will check. Is it going live? Akash, can you check, please?
Okay. I'll also check from my side.
Huh. Meanwhile, I will make it full screen. Yeah.
Yes, ma'am.
Friends, it's
It is
going
live.
live? Yeah.
Yeah.
Okay. Okay. So, friends, as you all know, my all presentations always start with my Mata Durga Rani Stuti. Ya Devi Sarvabhuteshu Chikitsa Rupen Samsita Namastasyai 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 Namo Namo. So, just a second, Diksha. So, friends, as we know, that this is the what are the now these days now what are the game changing innovations in ART from bench to bedside. So there are revolutionary advancements have happened in ART technique from NGS testing and time lapse embryo imaging to AI powered selection tools, and CRISPR applications are radically transforming fertility treatment success rates. So today we explore how these cutting edge technologies are moving from laboratory breakthroughs to clinical practice, offering the unprecedented opportunities for millions of patients navigating their fertility journeys worldwide. So, friends, as we all know that what is ART, I give some detail because this program is attended, Medisage programs are well attended by the gynae residents also. So, as we all know, this ART techniques include the IVF and ICSI and embryo preservation and PGT, pre-implantation genetic testing. So, ART now accounts for around 2 to 6% of the births in developed countries, transforming the reproductive medicine. This is the global data because it shows, as it shows, the 2.7 million ART cycles in the annual procedure worldwide, in 48% in Asia and 26% in Europe. 2 to 6% regional variance has been reported. So here, as in Denmark, 6.2, Japan 5.9, and Spain 5.4. The market growth of this industry is around 31 billion. The global fertility market is projected to rise around 45 billion by 2027. So now what are the historic milestones in the ART? So friends, here we can see, as we all are aware, in 1978, the first IVF baby, Louise Brown, born in the UK under the care of Dr. Steptoe and Edwards. After 102 previous attempts, this is a breakthrough in this ART. Then in 1992, the ICSI development by Dr. Gian-Piero and Pamelo, again a revolution in the infertility treatment by directly injecting a single sperm into an egg at Brussels Free University. Then again in 1999, the PGT, the pre-implantation genetic diagnosis. Then in 2005, the vitrification techniques pioneered by the Dr. Kusama, boosting the egg embryo survival rate. This ultra-rapid cooling method prevents the damage and ice crystal formation. Then in 2019, the first baby born from deceased donors transplanted uterus. So these all are considered as a major milestones. First, the IVF baby 1978, ICSI in 1992, 1999, the PGT, 2005, the vitrification, and the 2019, the baby born from the transplanted uterus. So friends, the next generation innovations in ART technique, as we know, the time-lapse embryo imaging, the continuous monitoring system allows the embryologist to observe the embryo development without disruption, improving selection and increasing implantation rate by 25%. Among this PGT, advanced PGT-A and PGT-M. So PGT-A for the pre-implantation genetic diagnosis for aneuploidy and PGT-M for the monogenic disorders. Then AI-driven embryo selection. These days, AI has come in all. So by the AI, a lot of improvement in this ART technique also to get the good quality of the embryos. Then the vitrification advancement also we have just discussed. Then coming to this CRISPR-Cas9 applications, I will show some details about this also. So in this, emerging the gene editing technologies which show the promise for correcting the pathogenic mutations and preventing the hereditary disorders in future clinical applications. Friends, so here we can see by these the enhanced success rates, expanded disorder detection, and safer pregnancy. With PGT-A, the clinical pregnancy rates by 10 to 15% in women over 35, and then it dramatically reduces the miscarriage rates from 40% to 10% on the advanced maternal age female. Then this expanded disorder detection, PGT-M now screens for over 600 single gene disorders, including cystic fibrosis, Tay-Sachs, and BRCA mutations, while this PGT-SR, which detects the structural rearrangements with 98% sensitivity, while carrier mapping allows the simultaneous testing for multiple disorders without developing custom probes. Then ASRM data has shown that effective single embryo transfer with PGT reduces the multiple pregnancy rates to under 2%. This decreases the preterm birth risk by 68%, reduces the NICU admissions, and thus reduces the cost also. Now, what is this CRISPR-Cas9? It is a revolution in ART technology. It is a gene editing technology, is transforming the fertility treatments by enabling the prevention of hereditary disease and genetic disorders. The global assisted reproductive technology market now exceeds the 33 billion, with genetic screening components growing at 12% annually. This revolutionary intersection creates unprecedented possibilities for families facing the genetic challenges, potentially eliminating over 10,000 single gene disorders from family lineages. Then, friends, this for this CRISPR applications, the enhanced genetic screening, disease prevention, lot of studies have done in the animals, and still lot of research is going on the humans also. So now coming to one by one, this PGT-A, the pre-implantation genetic testing for aneuploidy, it identifies the embryos with incorrect chromosome numbers, improves the implantation rates by 24% and reduces the miscarriage rates by 39%. Particularly beneficial for the patients of advanced maternal age. PGTM for monogenic disorders, it can detect more than 6,000 inherited conditions. It gives around 99.2 accuracy when it is combined with CRISPR. So then, by a clinical implication, that it requires a trophoectoderm biopsy of 5 to 10 cells at the blastocyst stage, day 5 to 6. Results are typically available within 24 to 72 hours, enables the selection of embryos with the highest genetic health potential. Then, as we all are aware about this time-lapse embryo imaging, in the embryoscope and primovision systems, which captures the images every 10 minutes without disrupting the culture conditions, the system generates more than 7,000 images over the 5 days, detecting the critical cleavage timing and morphokinetic factors. So, just a second. Yeah. So, as we all know, yes. Um, By this, using the two scores, the EVA score or the KID score algorithms, improve the implantation rates by 41% in patients under 30 years. These AI-powered tools analyze 100 plus developmental parameters to identify the embryos with 89% of probability of developing to blastocyst stage compared to 65% with the conventional morphology. So friends, you can see by this AI as a revolutionary changes around 89% possibility of the embryos of the developing blastocyst stage, while with the conventional method, this is only 65%. Non-invasive approach, the integrated incubator microscope systems like Gary maintain the optimal 37 degrees centigrade, 6% CO2 and 5% O2 conditions throughout the observation. Studies show 25% reduction in developmental arrest and 22% increase in blastulation rates compared to conventional monitoring requires the embryo handling. So the EVA and KID score, advanced embryo assessment. So this EVA, early embryo viability assessment, the time-lapse imaging technology that analyzes the embryo development patterns, measures precise timing of cellular divisions during the first 3 days, predicts the blastocyst formation, with 85% specificity. Non-invasive assessment reduces the handling risk. Then coming to the KID score, so these all have come very recently. So yeah. A KID score known implantation data scoring system before the embryo ranking, analyzing the morphokinetic parameters across the developmental stages, evaluates 12% developmental markers, including the fragmentation patterns, improves the implantation rates by up to 20% compared to the standard methods. Still, but friends, there are a lot of ethical issues, and every place there are different authorities are having a different rules and regulations. So this AI and machine learning in embryology. So a lot of studies has come in that AI selection has increased the live births from 48.9% to 62.3% in the women under 38 and reduced time to pregnancy by 4.1 months. Then this reduced human bias by, yes, of course, as we know, the in the conventional method there is some error by the human bias, but this error has been reduced by this use of the AI around the 99.3% consistency. This live CRISPR platform demonstrated 30.8% higher predictive value for implantation. Now, this genome editing and CRISPR innovations. So, friends, studies have shown that this CRISPR-Cas9 achieves 96.5% targeting efficiency with 0.6% of target effects in pre-implantation embryos. Disease prevention successfully corrected MYBC3 mutation, causing the hypertrophic cardiomyopathy in 72.4% human embryos. Then there are a lot of ethical considerations. So here, friends, we can see by this technique in 2020, the Nobel Prize winning technique has been demonstrated that 73% efficiency in correcting the beta thalassemia mutations and 68% in eliminating the PGD diagnosis hereditary diseases. Then this is non-invasive embryo assessment. So friends, here we can see the media collection, metabolite analysis, selection decision, and viability prediction. So this is based on miRNA selection-based protocol, around 32.7% increase in the clinical pregnancy rate. Then gamete preservation and oocyte vitrification, the ultra-rapid freezing. So here, friends, you can see the cooling rates of 20,000 degrees centigrade per minute with cryoprotectants like dimethyl sulfoxaflor, DMSO, and ethylene glycol prevents the ice crystal formation, preserving 92% of the cellular organelles. Long-term storage round viability maintained for 15 plus years in liquid nitrogen at minus 196 degrees centigrade with only 0.5 to 1.2% annual degradation. Then expanded applications enables the fertility preservation for 78% reproductive age cancer patients, has increased elective banking by 32% annually rise since 2018. Modern vitrification methods achieves 98% post-survival ex-survival rates compared to 55% with low slow freezing methods. Now coming to the another category, that what are the innovations in sperm retrieval and selection, microfluidic sperm sorting MSS, biomimetic channels with 18 to 20 micrometer curvatures select the sperm with 87.4% DNA integrity compared to 64.2% with conventional methods. Trials have shown that 29.3% higher fertilization rates with 41.8% reduction in early miscarriage. Then the MAX V selection, magnetic activated cell sorting eliminates the 94.6% of the apoptic sperm with fragmented DNA. Then AI powered the EMC selection. Now for this, the deep learning algorithms has been mentioned, which can judge around 1620 morphological parameters, that to also 6,000 magnification, detecting the sperm vacuoles of small as small as 0.13 micrometer. So clinical implications has been improved the blastocyst rates by 24.6% and live birth rates by 18.3% in male factor cases. Coming to the next. Then the OHS-free clinic modified protocols, the GnRH antagonist protocols, freeze-all strategy, GnRH agonist trigger, individualized dosing algorithms has been reported. So with this GnRH antagonist protocols, the flexible antagonist protocols reduces the OHSS incidence by 67% compared to the long agonist protocols while maintaining the comparable pregnancy rates. So freeze-all, the elective embryo cryopreservation and deferred transfer virtually eliminate the late onset OHSS. GnRH agonist trigger, replacing the HCG with GnRH agonist for final oocyte maturation, reduces the OHSS risk from 5.1 to 0.2% in high-risk patients while retrieving the 18.5% more mature oocytes. AMH and AFC-based stimulation protocol reduces the cycle cancellation rate by 48.6% and decreases the OHS incidence from 8.9 to 1.3. Then, friends, this is again one more the uterine organoids and artificial wombs. The endometrial organoids cultured from the patient-derived stem cells shows the 94.7% molecular homology with native tissue and responds to hormonal stimuli with 89.3% correlation to in vivo environments. The 3D models enable to personalize the implantation failure analysis with the diagnostic accuracy of 82.6% for recurrent failures. Partial aptogenesis systems have sustained. The study has done on the lamb fetuses. They have shown around 87.5% of survival rates. With this technology could potentially assist the 1 is to 500 women with uterine factor infertility and reduces the preterm birth complications by 38.2% through extended ex utero development for high risk pregnancies. Then what are the innovative gadgets are available for having a revolutionary lab quality management? So advanced spectral analyzers, automated sample processor. In this, the lot of processors, AI-driven robotic systems, which can handle the 200 plus samples in per hour with contamination rates of below 0.02%, eliminating the human error variables in critical testing procedures. IoT environmental monitors, digital quality management systems. So these all are advancements has been reported in the literature. Then personalizing the ART, omics and precision medicine, the genomics, transcriptomics, metabolomics. So whole exome sequencing identifies 76.3% of the gene causes of infertility compared to 24.8% with standard karyotyping. So this PGT guided by the polygenic risk scores has reduced the miscarriage rates by 41.2% in patients with recurrent pregnancy loss. Transcriptomics endometrial receptivity analyzes examining the 248 genes, predicting the implantation windows with 88.7% accuracy. RNA sequence of cumulus cells forecasts oocyte competence and embryo quality with 74.5% sensitivity, optimizes the selection for transfer. Metabolomics, molecular fluid, metabolite profiles, identified 18 biomarkers that predict the blastulation rates with 82.3% specificity. So friends, now we can take what are the real world breakthrough studies, the case studies. Friends, this slide is little overcrowded. So mitochondrial replacement therapy in 2016, which prevents the Lee syndrome by using the spindle transfer. Then the postmenopausal ART was done in the IVF was done in 74-year-old female in Guntur, India. Then uterine transplant. Then it's been reported in 2014 in Sweden. Then CRISPR gene correction by the Shanghai in 2018. Deep learning embryo selection by the Birmingham and Boston, USA in 2022. So what are the barriers and bioethics in ART innovation? Of course, the financial hurdles is the one important. Ethical considerations, the genetic gene editing technologies like CRISPR and HBB corrections raises the concern about the germline modifications and designer babies. Then regulatory challenges. So approval pathways vary dramatically. Mitochondrial replacement therapy is legal in UK in 2015 and in Australia 2022, restricted in Mexico and probably prohibited in the US. India implemented this ART Act in 2021, bringing the structure to previously unregulated services. So studies have shown, yes, of course, while handling these procedures, while handling the genetic material, you need the permission from the authority. So global inequity, while in this, the studies have shown that advanced techniques like time-lapse imaging and AI embryo selection remains unavailable in 76% of the countries. In India, mostly in urban centers, have access of advanced ART services. The WHO estimates the infertility affects 17.5% globally, within India reporting 14.2%. So, yet the treatment access correlates primarily with GDP rather than the clinical trial is needed. Then, what are the future directions in this? So, wearables and at home. So, the smartphone diagnostics, wearable monitors, and remote clinical trials. So, friends, the mobile sperm analysis apps to achieve 96.2% accuracy compared to the lab test with bio sperm test and exceed leading the adoption. LH search detection apps like Premom and Inito have introduced the clinic visits, which have improved the cycle timing by 37.8%. Wearable monitors. So Eras bracelet has got gives you the correct continuous temperature, enabling the 89% of the accurate fertility window. Then remote clinical trials has been done in 2024 for that using telehealth supervised ovulation induction with 63% of the cost reduction. So yeah. Then coming to the another advancement is the biosperm test, the smartphone-based fertility testing. The biosperm represents the one of the most validated smartphone-based fertility assessment tools for currently available at home diagnostics. Clinical validation for this is that 96.2% concordance between the bio app results and the standard laboratory semen analysis for motile sperm concentration. The technology platform, then the clinical impact for this is smartphone monitoring for assisted reproductive technology founds that the biosperm testing lead to 37.9% reduction in time to intervention for male factor infertility and 42.3% decrease in unnecessary clinic visit. So, with this proper fluorescent-based imaging technology, it can detect the sperm concentration as low as 6 million per ml with 91.5% sensitivity and 97.8% specificity. Then coming to another technology is the sperm bot technology, the microrobotics in fertility treatment. The sperm boats, also known as sperm microboats, presents a revolutionary approach addressing the male factor infertility by enhancing the sperm motility and fertilization capacity. So, what has done in this, they have found a helical metal microstructure 15 to 20 micrometer propelled by the rotating magnetic fields that can encapsulate the motile sperm cells and transport them to the oocytes, improving the fertilization rates up to 42% in the preclinical study. While clinical applications have suggested that intervention for asthenozoospermia, the 2023 trials have demonstrated around 3.8% improved sperm delivery to the site of the fertilization. The NIH uh, uh, the NIH funded Navigate trial evaluated the magnetically controlled sperm boat navigation systems. Then advanced wearable fertility monitoring device. Friends, in this, the AVA bracelet has been reported tracks, which is the 5 physiological parameters, a kind of the bracelet, which shows down the accurate 89% accurate fertility window. A lot of studies have been presented. Mira Plus monitor, which quantifies the estrogen LH levels with 99.1% lab grade accuracy. Then temperature drop algorithm, specialized algorithms, filters sleep disruption for the precise basal temperature readings. This all has been reported: Eva bracelet, Mira plus monitor, and of course this temperature drop. So studies have shown that by using these techniques, definitely the chances of getting the positive pregnancy test and live birth rates will be the more. So, conclusion for this: the impact and promise of ART innovation. ART innovations have helped over 9 million babies born worldwide since 1978 for 17.5%, uh, with the global population affects by infertility technologies like CRISPR, time labs, imaging, and enhanced selection provides the pathways to parenthood previously unimaginable, accelerating the process, collaborative future. Then coming to this gene editing and CRISPR innovations. So friends, for this, a lot of studies have been presented very recently in 23 and 24. Uh, 23, they have presented the successfully edited BRCA mutations embryos with 92.6% efficiency, um, and minimal off-target cells, potentially preventing the hereditary breast and ovarian cancer. Multi-centric trial they have done in this study that establishing the standard protocols for clinical implementation with 98.2% consistency. Similarly, these are so many studies has been presented for this. Then for this, AI and machine learning in embryology, enhanced embryo selection, predictive analysis, automated embryo systems, and remote monitoring and analysis. Then gamete preservation and oocyte vitrification. So yes, so the egg fertilization, the egg freezing success rates ranges from 20% to 95% through ultra rapid uh, vitrification, and utilizing the specialized cryoprotectant cocktails. The 95% survival rate, 48% the life birth rate, and 15 plus years are variable, minimal quality degradation in proper storage conditions with validated um, birth from eggs stored over the 15 years. Then the innovations in the sperm cryopreservation, advanced cryoprotected formulations, controlling the rate of the freezing technology, CASA integrated system, and extended viability duration. Then coming to the designer babies, the next frontier in the reproductive technology. So in this, the uh, enhanced protocols enabling of selection, genetic screening, disease prevention, and CRISPR technology, uh, achieving 99.7% on target editing with off effects. Then coming to the another revolution is the stem cell for the regenerative medicine, precision cell programming, organoid development, tissue engineering, and cell therapy applications. Then, yes, already I have discussed. Then coming to this ovarian transposition, the fertility preservation technique. In this, the surgical relocation of the ovaries away from the radiation to minimize the coronal damage during the pelvic radiotherapy preserves the ovarian function in 88.6%. So, studies have shown that by this, uh, the radiation exposure can be reduced by 90 to 95% when exposed, transposed 3 centimeter from the radiation field. So, a lot of studies has come, friends. So, ovarian transposition, either the lateral, medial, or the varies based on radiation field and tumor location. It requires the careful preservation of ovarian vasculature, preserves the ovarian function, in 70 to 95% of the cases, reduces the radiation exposure by 95%, is the future natural conception by 30 to 45% cases. So yes, in this, the ovaries, if the radiation is planned, either shift in the paracolic gutter or to the other places. So studies have shown that mitochondrial DNA assessment from trophoectoderm biopsies predicts the implantation, artificial intelligence in embryo, non-invasive PGTA validation. So what are the recent PubMed articles are published is advances in embryo uh, selection, novel AI-driven approaches, which shows around 31% higher implantation rates, optimized culture systems, time, course, and metabolic profiling of culture media uh, identifies and key markers, biomarkers predictive of blastocyst development with 83% accuracy, then endometrial receptor markers, then mitochondrial functions in oocyte quality. Friends, actually, this is a very vast topic. So now what are the ground breaking of ART innovations in 2024? Non-invasive PGTA, then time-lapse microscopy data, then hormone tracking, ultrasound data. The innovations will represent the convergence of artificial intelligence, genomics, and digital health technologies. Then ethical, legal, and safety considerations. This is a very, very um, topic of controversies, that what are the regulatory restrictions are allowing, what are not allowing. So I better suggest to find out the what are the rules and regulation in your country and at your place. Um, so the future direction and potential impact, the present day 23 to 24, the CRISPR research limited to non-viable embryos with within 14 days cultivation in cultivation restriction. Then studies for the near future, the phase 1 trials with CRISPR mediated correction of BRCA1 and BRCA2 mutations and Huntington disease. Among in the midterm 2030 to 2035, conditional approach for specific monogenic disorders under the International Genomic Medicine. Then the long-term vision for 35 plus, the integration of the KID-score and CRISPR precision editing, enabling the simultaneous assessment and targeting the correction. So identify more than 1,200 hereditary disorders. So the pathway for balancing the innovation and ethics, ethical framework development, safety enhancement, research, public dialogue, and regulatory harmonized health. What we follow this. So friends, this is actually a very vast topic. I tried to summarize. Still, there are a lot of controversy related to this, and lot of queries are still coming. See this bio apparatus, these are the Mira monitor, EVA parameters. So these all have come very recently. So once you go and search, you will get lot of information. So let me take the questions. I think Diksha has posted. Yes.
Yes, there are three questions, ma'am, in the chat box.
Yeah.
So
Yes.
how has
Yes.
the use of artificial intelligence in embryo selection changed your clinical outcomes, and what limitations do you still observe?
Yes. Yes. So Diksha, as I just shown you, say using this artificial intelligence, the success rate of the procedures from in 62 to it has been increased up to 89.3%. So what are the limitations? First and foremost, yes, the cost increases. Already the ART procedures are very costly, then definitely the cost increases. Secondly, the person who is properly trained for this AI, that can only suggest you about or guide you that how the results are coming. So before we will go in the deep dive into this. Yes, you have to have some knowledge about the AI also. So yes, the proper training as the different apps are coming, different belt systems are coming. So first the proper training is required, and then you can involve or you can use that technology in your clinical practice. Okay.
Yeah.
Next we can take Diksha.
Yeah. The second question is, how do you explain to patients the ethical issues and limits of doing expanded carrier screening and full genetic testing on embryos?
Okay. See, this is a very tricky question, Diksha. So, yes, I usually see the patients who are approaching to us in whom the history of some genetic abnormality of the baby, or some are having a history. Recently, one couple has approached me for the
Hmm.
syndactyly. Syndactyly मतलब उनके फिंगर्स जुड़े हुए थे, फिंगर्स. तो
Okay.
फादर के भी फिंगर जुड़े हैं, उसकी सिस्टर के भी फिंगर जुड़े हैं. या wife is totally normal, and her
Hmm.
father means the guy's
Parent.
father is also having a syndactyly, and he is having three brothers and two sisters. Matlab they are total seven siblings. So all are having the syndactyly. So so the question comes that is it like that if they will go for the natural pregnancy, is the again the baby is also going to have that? Because the couple once approaches to me for the second opinion because they had gone somewhere to know about this, that so someone told them there is no latest technique, no friends. So there are a lot of new techniques. Of course, they are very costly. So while
Hmm.
if they are going for the IVF, yes, I have just shown with the embryoscope all the pictures we are taking. And of course, these technologies, the CRISPR and these technologies, these are available in some tertiary care centers only. So better we can refer the patient there, and there all the gene studies, NGS and other studies can be done, and we can identify by the trophoectoderm biopsy of the blastocyst that whether the disease is going to transmit to the baby or not. So yes, lot of advancement is there. So all the
Hmm.
things we can't do in the small setup. So, but for that, the some tertiary care setups, and in that also the person who is properly skilled and properly having a knowledge for that. So खाली ऐसा नहीं है कि AI है तो आप कर लेंगे. The person who is having a proper knowledge for that, because this AI is also machine driven, is driven by the human only ना, हम लोगों की तरफ से ही
Yeah.
डेटा पुट किया गया है AI का. So having a proper knowledge is must. So now
Right.
we will take the, yeah.
What safeguards should be in place to ensure responsible use of
Uh,
gene editing technologies like CRISPR in reproductive medicine?
yeah. So my dear, as I have shown in the PPTs also, see, depending on the regulatory authorities that because see in India only, I am
Hmm.
in Pune, my some friends are in Delhi, some friends are in the Punjab. So the regulatory guidelines are not like that. Everywhere there are different guidelines. So
Hmm.
ऐसा भी नहीं है from the usually the routine guidelines has been given by the Indian Council of the Medical Research, ICMR. So now,
Hmm.
but in your place, what is the strategy is followed by the your I don't want to take the authority name. So by your authority is giving you the what rules, and so you have to inform
Guidelines.
them proper, yeah, and guidelines. So you have to
Hmm.
inquire there, and then only you can start. So अभी CRISPR तो यहाँ पर तो नहीं है, but yes, in some centers in Mumbai they have started. So yes, you can go through, you can read more and more, and of course the for the gene editing techniques, yes, you have to take a proper permission, and still in India में gene editing allowed नहीं है. In some countries, yesterday I have a discussion uh, with some other doctors, so they are also saying in there some countries only the gene
Hmm.
editing is also allowed, but they have also have to take the permission from their authorities. So still, this is
Okay.
a procedure which has come. Still, a lot of research and lot of trial has to be done, and still a lot of studies are going on. So still, have not reached the conclusion. But what are these recent advancements? That's why I have put
Hmm.
this on the presentation.
Great, Dr. Great. So there were three questions in the chat box that we have already discussed, and I think
Yes.
this topic was
Yeah.
very heavy, and
Yeah.
still a lot more is will go into this in future. So now it's time that we move towards the closure. So
Yes.
we
Yes.
extend a heartfelt thank you to you, Dr. Ritu Santrani, for sharing your valuable insights on today's session on game-changing innovations in art, and your expertise and forward looking perspectives truly illuminated the latest breakthroughs shaping the future of fertility care. So, we are confident that our audience found the session both inspiring and enriching, and we look forward for more such impactful sessions and discussions in future as well. So, thank you once again for joining in, Dr. Ritu, with us. Thank you so much.
Thank you, dear Riksha. Yes, I always have a passion for the knowledge sharing. As much as you read, you will get the more knowledge. The more you share, the more knowledge you will get. So I can say because Diksha was after me, ma'am, you have to take something recent about what are the developments for that. Though I know about this and the microrobotics of the sperm, but to make a presentation is yes, once while making the presentation, I also gained a lot of knowledge. And similarly, whenever you share the knowledge will multiply. So with this, we will wind up for today. So thank you. Thank you everyone, those who have joined. Bye-bye.
Thank you, ma'am. And that is why you are the top 50 influencer, because the
My
learning is
dear,
an
thank you.
ongoing process.
Thank
Thank
you.
you so much,
Thank you, my
everyone, for joining in today.
yeah.
Namaste.
Thank you, my dear. Bye. Bye-bye.